Lung cancer is a rapidly growing concern, often diagnosed late due to its symptoms mimicking other respiratory conditions. Early detection is key to improving outcomes.
Lung cancer happens to be the fastest growing cancer in our country, and unfortunately, it's always diagnosed in a late stage. And the reason why it is diagnosed in the late stage is because people are not able to pick it up in early stages, and that is the precise reason why that they are not able to, because the common sign and symptoms are very similar to other respiratory problems, especially tuberculosis. Hence, it is very imperative that we understand what are the most common signs and symptoms. And once you listen to all this, you will realize that they are very similar to tuberculosis or respiratory infections that we have. So the early signs and symptoms that can show lung cancer are: one, shortness of breath, difficulty in breathing, chest pain, especially on taking deep breaths, and blood in cough. Now, these are the commonest symptoms that we see in during early or a little advanced lung cancer. But as the lung cancer advances and it might spread to other organs, that the patient can also present with a swelling or a lump in the neck. They can also present with bony pain, especially pain in the spine region where the disease has already spread. On Unfortunately, if the disease has spread to the brain, then they might present with some symptoms like seizures also. So these are the most common symptoms of lung cancer in various stages that are available. It is really difficult to differentiate between lung cancer and other respiratory illnesses, especially tuberculosis. But it is our humble request to anybody who is treating respiratory symptoms is that if a symptom is persisting for a longer duration of time, if a symptom is not responding to your common respiratory treatment, especially that of tuberculosis, you must investigate that patient for lung cancer. Especially if the patient is a smoker, then it is imperative that lung cancer should be ruled out. In This is also important for respiratory physicians who start tuberculosis medicine, that we should have pathological proof of tuberculosis in form of either microbiological diagnosis of tuberculosis or presence of granulomas in any of the biopsy which is done. These are the only ways in which you can differentiate between tuberculosis and lung cancer.
Recognizing persistent symptoms early can make all the difference in diagnosing and treating lung cancer effectively.
I think timing is of utmost importance here. There is no hard and fast guideline that beyond this particular stipulated time you should meet an oncologist. But in case the symptoms are persisting for a longer duration, say 3 to 4 weeks, and they are not responding to treatment on lines with the respiratory medicine, in that case, we need to start treatment. We need to consult an oncologist and get ourselves tested to rule out lung cancer.
Lung cancer symptoms are often consistent, regardless of smoking history. Early detection remains key for both smokers and non smokers.
So there is no difference in terms of the symptoms that we see among smokers and non-smokers. Yes, the type of cancer may change between smokers and non-smokers, but the symptoms are usually similar, and we don't see much difference between presentation in either of the two type of cancers.
Advancements in technology and medicine are transforming the way we diagnose and treat lung cancer, bringing new hope for patients.
So AI is creeping up everywhere, and we are very hopeful that AI will help us diagnose lung cancer better. People who are getting screening X-rays done, people who are getting screening CT scans done, they might be exposed to their report being read by AI, and we might be able to pick up diseases which might be missed by the human eye. So that is what our hope is. But it's a very exciting time for treatment of lung cancer. We are seeing more and more drugs, especially immunotherapy, now being more and more available, and with greater evidence showing good results in both early and advanced cancers. Robotics in lung cancer surgery has also made surgery for early lung cancer very easy and safe. Similarly, better radiation machines are providing us with a more precise delivery of radiation therapy, allowing us to target our lesions better.